supplement. So next is our thyroid gland. So our thyroid gland uses iodine food to make two thyroid hormone that regulates the body, uses energy. So those two thyroid hormone is the T3 and T4. The T3 is triiodothyronine, which support brain functions, heart functions, digestions, and body temperature. So it plays a role in your metabolic rate and bone health. So in T4, thyroxine is responsible for metabolism, also mood and body temperature. So if there is a increase sa thyroid gland, so if there is an increased production of T3 and T4 rather, so mag-increase po na itong basal metabolic rate. So hyperactive ang person, so they are they have an ability to focus, so insomnia, increased catabolism, so weight loss. Nga nung magka-weight loss, it's because paspas ilang metabolic rate. So paspas ang digestion sa food. So dili na ma-absorb tong mga nutrients na needed sa body. So increase ang appetite, so increase po din ang peristalsis, kay paspas na metabolic rate, so it would lead to diarrhea, so fluid volume deficit, then increase cardiac rate and RR due to increase basal metabolic rate. So increase T3, nganong na sila heat intolerance, because T3 is also responsible or affect our body temperature. So that's why when a person is having a hyperthyroidism, so they are heat intolerant. So calcitonin its main job is to lower calcium level in your blood, so not in bone. So if decrease ang atong calcium in the blood, so that will results to tetany. So tetany is a involuntary contraction of the muscle. So if there is a lack of calcium in the blood, so tetany, our muscle is gonna try to compensate ang katong blockage. So calcium withdraws from the bone. So instead na mag-store ang calcium sa bone, so mag-excrete na siya dito sa atuang bloodstream. So bone destructions, complications may occur such as osteoporosis. So PTU is a treatment or management to decrease the synthesis or production of the thyroid hormone. So we need to watch out for side effects. This is similar to signs and symptoms of hypothyroidism. So watch out for agranulocytosis. We need to watch out for agranulocytosis is the decreased WBC count neutrophils. So if babang ato ang WBC or neutrophils, so they are prone to infection. So fever, skin rash, and sore throat. So logo solution is a management before undergoing a thyroidectomy. So logo solution is to decrease the release of thyroid hormone before thyroidectomy. So decrease vascularity of the thyroid gland. So in decrease naman sa T3 and T4, so it would lead to hypothyroidism. So decrease ilang basal metabolic rate, luya sila, they sleeps a lot, then decrease ang ilahang metabolism, so it would lead to weight gain, so anorexia, so decreased peristalsis, so they are prone to constipation. So decrease po nilang cardiac rate and RR due to decrease ilahang basal metabolic rate. So ang sa hyperthyroidism is they are heat intolerant and they have heat intolerance, while the hypothyroidism is they are cold intolerance. So calcitonin, na sila hypercalcemia, so there is a stone formation in the blood. So our nursing management here is increased fluid intake. Then centroid and proloid is a treatment to increase thyroid hormone secretion or production. Next is our adrenal gland. So our adrenal gland consists of so our adrenal gland produces hormone that helps regulate your metabolism, immune system, blood pressure, response to stress, and other essential functions. So this composed of two parts, which is the cortex and medulla, which responsible for production of different hormones. So if increase ang atuang so Cushing syndrome occurs when your body makes too much hormones cortisol, too much hormone called cortisol. So ang ato ang adrenal gland is produce two hormones, which is the aldosteroid or the mineral corticoid, then the cortisol or the glucocorticoid. So our aldosterone regulates BP, retaining sodium, secretes potassium. So cortisol is stress hormone. So this would help the body deal with stress. So increase ang blood glucose by metabolizing sugar. So mo to help man ang atong cortisol to convert protein into glucose. So glucocorticoids, hyperglycemia, and decreased wound healing. So if there is sugar, hyperglycemia, so if increase atong sugar, so mag-decrease atong wound healing. This is common to diabetic people. So if mineral corticoids, increase aldosterone, sodium retention, and potassium excretion. So hypernatremia and hypokalemia. So hypernatremia is a too much production of sodium in the bloodstream. So this would result to water retention. So fluids may accumulate or build up in some parts of our body. So oliguria, which leads to oliguria, the low urine output, then edema, fluid build-ups like moon phase, buffalo lung, fluid volume excess, and weight gain. Then concentrated urine, increased urine specific gravity, low, and the management of this is low sodium diet. It's because, as I mentioned before, sodium will promote fluid retention. So we need to have a low sodium diet. So hypokalemia is decreased potassium in the body. So it would lead to weakness, prominent UV wave. Then our management is high potassium diet. Then if increase ang atong cortisol, so mag-increase pod ang atuang fight or flight response, the epinephrine and norepinephrine. So increase po datong BP and cardiac rate. So ang sex hormones is in male, gynecomastia, falling of hair. So gynecomastia is enlargement of the breast. So in people with hyperthyroidism, with Cushing syndrome, is they have a unusual size of the breast. So dako sila, medyo dako ilang breast sa male. Tapos sa female is hirsutism, and depending of the boys is kanang they have a hair strand like male, tapos medyo dagko sila og tingog. So if decrease po ang atong cortisol, so mag-lead po siya og Addison's. So glucocorticoids, hypoglycemia, and inability to cope with stress. So if ever there is a lack of sugar in our bloodstream, so we are unable to cope with stress. So mineral corticoids, so decrease aldosterone, so mag-decrease ang aldosterone, so sodium excretion, potassium retention, so hyponatremia and hyperkalemia. So hyponatremia is baba ang sodium level sa atong blood. So this would lead to polyuria, excessive urination, so that will result to dehydration, fluid volume deficit, and weight loss. So diluted urine, decreased urine specific gravity. So our management to this is increased fluids and sodium intake. So hyperkalemia is increase ang ato ang potassium level, so that would lead to weakness, tall or peak T waves. Then ang management is low potassium diet. So ang ato akong fight or flight response is decrease, kay nag-decrease man pod ang ato ang cortisol production, so mag-decrease pod atong BP and cardiac rate. So that's all for the That's all for the endocrine gland.